Thank you, Premier. Can I just add my thanks to the Shepparton community? I've got mates in Shep. I know that they understand how much people surged in response to the call out for testing, how that had its own challenges, but they are rightly proud of the Shepparton community for how they've responded, and it has been a fantastic piece of reassurance, really, for how we can respond to individual cases in communities, how people can quarantine appropriately, and we can be absolutely sure that those cases are properly contained and that there's a safe ring around any of those close contacts. That is an ideal response, and really it's a model for how it might occur for individual cases in Metro Melbourne going forward, or anywhere else in regional Victoria. We'll have those challenges, but if people respond in the way that the people of Shepparton and Kilmore and elsewhere have responded, then we'll do very well. The two cases today, one is linked to the known Hoppers Crossing outbreak, and the other one is preliminary linked to some North Metro cases. So that is reassuring. We don't appear to have mystery cases from today's two cases. But we do have another mystery case that has been settled. It's for postcode 3081, that's Heidelberg Heights, Heidelberg RGH, Heidelberg West and Belfield. Yesterday I spoke about Box Hill and surrounds having a mystery case. So that's really just to emphasise that there's at least another unidentified individual, potentially chains of transmission in those areas. And again, people with any symptoms at all should get tested straight away and should isolate after that. The interviews are indicating that people haven't been to those high-risk sites that are listed on the website, and it's not clear where they've picked it up. It again points to the importance of wearing masks for all of those outdoor activities that you're involved in, whether it's food shopping or other essential business outside of your home, including meeting others with the new limits from midnight tonight. Thank you.
Very good. We're happy to take any questions you have.
The new but are you aware of that? I guess it would be linked to that Kilmore cluster.
No, I presume that's just come through the team now.
They posted the last an hour ago.
There you go. So that'll be investigated. Obviously, there's a link in Kilmore. We'll need to look at whatever connections might be made with the known positive cases in Kilmore. That bakery, no doubt, will be shut. No doubt, contacts will be quarantining as a result.
Is that a surprise? Did you think that cluster was fully contained?
Oh, I think we were pretty confident that we'd looked extremely hard for anyone who had contact with that cafe and all of those who'd tested positive in Kilmore. So yes, it's surprising. Again, we need to keep prompting people to test more broadly if they're symptomatic at all. So we'll follow up accordingly.
Professor Young mentioned that there was a mystery case in Box Hill. There was obviously an outbreak at the Box Hill Hospital very recently. Have you been able to determine where that outbreak originated from?
No, not clearly. I mean, we've worked out some of the connections between households and Box Hill Hospital, but how it was introduced and who the index case was in that outbreak isn't clear yet.
We don't know if it's a staff member or if it's a...
No, we don't know. We don't know the index case.
And is there any chance that we can ever find out?
Well, I think we're always looking. Sometimes the genomics again tells us that it's related to something that we've known about, and we can go back and reinterrogate all the individuals as to whether their connections have any relationship to those sites or settings.
Just on community transmission, a week ago Alan Cheng was here saying the thing he's worried about most is community transmission. The numbers really haven't come down that far since then. Why are you confident and comfortable now about opening up, given there hasn't been much shift in the numbers?
Well, I think clearly the total case numbers every day are coming down, and significantly just in the last few days as those outbreaks have come under control. And as total numbers come down, I expect that will show in the community transmission cases as well, or the mystery cases. We've got a panel review in a few minutes. I'll need to leave on all of our mystery cases in the last 14 days. They go through an individual review process, but Alan and I want to look at each and every one of those. There might be some that get knocked off because of the review of pathology and epidemiology and everything else in relation to those cases. So I think those numbers will drop over time, but clearly they plateaued for a while there.
Just in terms of opening up, are you nervous when you make these decisions about today?
Oh, they're high stakes decisions, absolutely. I can never be complacent about them, and we're precautionary about them, but we're all on tenterhooks about how you manage each and every single case, knowing what the potential is. When sometimes the transmission is not in an easily controlled setting. So yeah, we remain nervous, but I'm confident we're going in the right direction. It's really clear that we've gone in the right direction for several weeks.
What do you need to see to be happy to allow people from multiple households gathering in private homes?
Look, we'll come to that when we come to it. I think we're talking about the next couple of weeks now, but we go through that review process over the next couple of weeks to see what's allowable in terms of multiple households and meeting indoors.
Ideally, no community transmission cases, no mystery cases.
Oh, ideally, but again, we wouldn't have that as some absolute threshold.
Professor, just on the AHPCC meeting where the arriving New Zealanders were discussed, you said you weren't there, and it now appears that you were there. How did that slip your mind, I guess?
I was not there for the beginning, and I was not there for that part of the conversation that was referenced yesterday. I think I was in at the 45-minute mark or thereabouts. I checked with the Secretariat support that we have at state level, so I wasn't there for that particular discussion. I was there for the broader discussion around a risk stratification process for international arrivals, where how that assessment might be made was discussed.
And just on the 25-kilometre limit, the Premier said that it was a decision made on the best health advice available. Can you just clarify whether it was a decision made by the public health team or by the Premier's office?
No, it was public health advice. Yeah.
Professor Sutton, yesterday emails emerged that contradicted your testimony at the inquiry about what you knew and when on private security. Then yesterday, as we've just discussed, that you said you weren't at Monday's meeting with health experts where New Zealand travel was discussed. You said you weren't there on Monday, not that I can remember. It's now been revealed. You were there, you just weren't there for that specific part.
Correct.
How can Victorians have confidence in you, considering that your version of the truth, I suppose, keeps changing?
I think I've just responded to the question about not being at a meeting where a specific issue was discussed, so I hope that's settled. In relation to the emails, I've probably had 30,000 emails on coronavirus since this has started. I get up to 150 a day. I'm in copy for many of them. Many of them run to several pages. If I've missed a reference to security in late May when the program was established, I'm sorry. It hasn't registered. So when I've spoken to the inquiry to say exactly that was the case. I was never involved in the decision making around private security. I didn't get asked my opinion on it. I wasn't involved in the setup of the program, and I didn't have a command or control role. And as I said to the inquiry at the time, my public health team were trying to make a case for stronger oversight from the public health team, so I was keen.
The Commonwealth Health Department has confirmed you were there throughout the whole meeting on Monday and also on Tuesday.
So I wasn't there the whole time on a Monday. I think that's been made clear.
Convenient that you weren't there for that.
How can it be convenient? I think I was here.
Inconvenient, I suppose.
I think I was here prior to that meeting. I think I was going to my office from here at the time that it started, so I couldn't get there on time.
I suppose it's just in the last 2 days we've seen emails that you were part of that included private security. That's been such a critical issue in the whole hotel quarantine program. Now, you said yesterday you weren't there at this other really important meeting. Now we're hearing that you were there. It's just a bit hard to follow.
I wasn't there because I was here. I go to those meetings whenever I can make it. If I've got other commitments, my Secretariat support is there to note I get that information at the end of every meeting. I think Alan Cheng was there for the entire meeting on the Monday. So, Victoria has representation. My deputy was there.
And Premier, a question please
Sure.
on just the retail timeline.
I would have thought it was a